quite a complicated medical history, specifically on my left leg. 2 ACL repairs. I've had some lateral cartilage repair. It's called an Oates procedure. I had a third surgery that was a revision to clean up my knee. And I also had a procedure on my left hip to repair the labrum, as well as to shave down the bone. So my knee has given me some issues over the past 10 years. I'm 35, so I'm not that old. And it started about when I was 23. In this particular instance, I had been doing some hard exercise. In this case, it was tennis. And I was really training. So I was really pounding on my knee on hard courts. And I experienced some swelling and pain after an intense session that prevented me from walking for about 2 weeks, or walking extensively for about 2 weeks. I realized it was time I should probably look into getting something done. And that led me to seek out Professor Wilson. So I went on a long hunt where I was looking on various medical sources through my insurance provider, Bupa, and I ended up landing on Professor Wilson. And I was through the first consult, I was so impressed by the way he interacted with me. And again, the way he used his collective experience to look specifically at the problem I was having, that I actually chose to not use my insurance in that case, and I chose to go private with Professor Wilson. Probably the thing that stood out to me most in my interactions with Professor Wilson was the unique way he went about diagnosing, or assessing, I should say. When there was an area where it seemed he needed additional information, he looked to a practice that I think isn't as common in the industry, which was I believe it's called active ultrasound. And it was very interesting, both the passion by which he took in my case and the interest in resolving my specific problem, but also finding unique ways to do that. The recommendation was to do a course of BMAC and PRP in both knees, and to arthroscopically, or via a very small incision, and in a minimally invasive way as possible, go in and inspect the area that I was experiencing this additional pain, or that pop that I had referred to. And in that area, he then determined an extraction, as they call it, a excision was required. And then that was also in conjunction with the active ultrasound that we had done prior. So in summary, the procedure that he recommended was the lateral osteophyte excision and ultrasound-guided injection of PRP, plus the course of BMAC. The osteophyte excision and removal of the scar tissue was, I think, more than we had initially anticipated. The next day, I was quite swollen. There wasn't a lot of pain, which was nice. It was quite sore, but it was quite a hefty procedure. So with that, nothing more than I would expect. It was a lot of icing, and a lot of elevation, and a lot of relaxation for a few days. But in general, I felt okay, just sore and not super mobile, but not as bad as I thought I would. Or Professor Wilson's team, I should say. They're quite helpful. They're all very quick to answer and respond. The hospital in which he operates is great. It's very nice, clean, and the team there, this surgery team, all of the people were great. Created a very comfortable environment. We often expect doctors to know everything. We often expect them to be just these superhuman people that can understand and deal with any problem and have all the knowledge in the world. I would rather have someone that's willing to admit where their expertise kind of ended and be able to use their collaboration skills and the willingness to work with others and be open to a team environment, to be able to rely on others' expertise to in the end give you the patient the best possible diagnosis, route forward, and overall experience.